Now, a 24-year-old model who won last year's Miss England contest is to undergo an operation to deal with varicose veins. Charlotte Moore says she wants to persuade young girls who may be embarrassed about having the distinctive blue and bulgy veins to see a doctor. A varicose vein appears when the valves in a vein stop working and the blood starts to flow down instead of up, gradually collecting in one place. The condition is commonly associated with older women or pregnancy, but it's now known an equal number of men are affected, and recent research suggests many young people are also suffering from varicose veins. Ultrasound scans reveal that 1 in 9 girls had lost valves in their veins by the ages of 18. So we're asking, are you a young person who's been suffering from varicose veins? You can give us a call on 0500 288 291 or email vine@bbc.co.uk. And joining me, Charlotte Holmes, Miss England 2012, and Professor Mark Whiteley, consultant vascular surgeon. Let's start with you, Charlotte. Hello and welcome.
How are you doing?
I'm doing fine, thank you. I had a good look at your varicose vein, though. I mean, it's a relatively insignificant looking affair, I suppose, unless you're having your beautiful legs photographed all the time, which you must be.
Well, this is the problem at castings and various other things. It comes up and it's like, oh, what's that on your leg? You know, how did you get that bruise on your leg? And people don't really get it. It doesn't bother me. I'm not embarrassed about it. But obviously I didn't realise the health risks until I met Mark.
So if you had not been having your leg photographed regularly, or both legs I should say, you probably wouldn't have bothered seeing a doctor, would you?
Probably not.
So you don't have any pain or anything like that? It's just it doesn't look pretty?
People ask questions about it because of my job, so I mean, you know, I'm not embarrassed about it at all. It's just one of those things I thought, well, I'll get it seen, and you know, perhaps there's something they can do about it. And when he said, you know, you can get X, Y and Z and all these problems, I'm suddenly panicking. I'm like, get it out quick.
Okay, let's get him to explain the X, Y and Z, because it's slightly more complex than that, exactly. Isn't it? Prof, hello, thanks so much for joining us. So she's got what looks like a sort of a squiggly blue line on her leg. It's about 2.5 inches long. It's pretty thin. It doesn't look like a big deal. It certainly doesn't look like one of those great big clusters of knobbly looking veins that you sometimes see. So why is it necessary to do anything to treat it?
Well, thank you very much for having me on the show. It's very interesting. The whole thing with varicose veins goes back in history. If you look at, there's a text by Shusharuta which was 3000 BC, and of course back in those days all they ever used to do is they used to talk about what they could see, and unfortunately 5,000 years later we still do the same thing. The fact that you've assessed it by saying it's only a small blue thing, and then you say it's not like a big clumpy blue varicose vein, means you're assessing it with your eyes. And what we now know is there's about 20% of the population have varicose veins you can see, whether they be small, big, whatever. But there's another 20% who have what we used to call venous reflux or venous incompetence, but to try and help people, in my book I've called it venous hidden varicose veins, because it gives you the understanding that there's something going on behind these veins, and you can only assess veins with an ultrasound. So Charlotte, for instance, she looks like she's got a small thread vein, not really even as big enough to be a varicose vein, but when we did an ultrasound on her, in fact she's lost the valves all the way up to her knee. Now they used to think that varicose veins came from the top. They used to think it's being fat, pregnant, all the things, which is why people thought it was women, and now we know that's not the case. It's genetic. It starts around the knee and it works its way up the leg, and probably due to the genes actually stopping the valves from working properly and regressing.
Well, when you use the phrase she's lost valves,
that's right.
It sounds absolutely terrifying. It sounds like, how could she possibly be looking as beautiful and rushing around the place with all these lost valves? But it's not as, is it or isn't it as bad as it sounds?
It can be. The trouble is everybody still classifies by what they see. So on one side you see somebody with a little varicose vein or a little thread vein, you say that's only cosmetic. On the other hand, you see some poor lady or man sort of, you know, in their 40s, 50s, 60s, 70s with a leg ulcer. In fact, I had a 19-year-old with a leg ulcer the other day, which is an open sore that just is being bound the whole time. And the trouble is the underlying cause is the same in both cases.
And what is the cause?
It's the valves being lost or gone.
And why does that lead to an ulcer?
So what happens is when if you lie down flat, you don't have a problem. Blood flows from your feet to your heart because there's just enough pressure to do that. When you stand up with gravity, blood can only get to your ankle. It just can't get back to your heart. So what you have to do is you have to move, and that's why movement is so important in exercise. And as the blood goes up towards the heart, it has to ratchet up when you move, but it mustn't fall back down again when you don't move. Otherwise it wouldn't keep going forward. Now, if the valves which stop it falling down are failing, then every time you shoot blood up your leg, then when you relax to swing your leg forward, it falls back down, and that has effects. If you're lucky, it'll come to the surface and you'll see it, because then you'll say, I've got varicose veins, and you'll get them fixed. If you're unlucky, it stays on the inside, you get inflammation around your ankle. And if you have that for a few years, it's starting a bit aching. You go to the GP who tells us nothing wrong with you because they can't see anything. Then a few more years later, you start getting some swelling of the ankles. Still nothing's done. Then you get some skin damage, some red damage, then some brown damage, and eventually leg ulcer. And all that time, you're told you don't have varicose veins because you can't see them on the surface.
Now, does that mean that as patients, we have to be a little more crusading, a little bit pioneering, and we have to say to our GPs, well, actually, I'd like an ultrasound examination, please. I need to see if there's anything going on under the skin, particularly if they've just listened to you on Jeremy Vine's show and they've heard about this for the very first time and had absolutely no idea. Should we say, well, actually, treatment's moved on. I know you can't see much, but I'd like you to check further?
Interestingly, this is a very appropriate time to ask that question, because just on the 23rd of July, the National Institute for Health and Care Excellence, in other words, NICE, have just put out their new varicose vein guidelines, and exactly that. If you have varicose veins and aching, or anything else to do with varicose veins, including leg ulcers, your practitioner should refer you for an ultrasound. And it says specifically you should go to not just one doctor sitting there with their own ultrasound, but you should go to a team which includes a doctor who treats veins and a specialist who has an ultrasound. It's got to be a multidisciplinary team to get to the bottom of it. And no doctor or nurse anywhere should ever pass a comment on anyone's legs unless they've seen the result of that ultrasound. Otherwise, they're guessing.
Goodness, so some people will be thinking, gosh, that sounds expensive for the NHS. All these people are happily hoppling around, with their varicose veins. Everybody's going, oh, it doesn't look that bad to me, goodbye. Suddenly you're going to say, well, I don't just want a doctor, I want a team, and I want specialist equipment. Now get me that right now, and it's going to be a great big bill for all of the rest of us to pick up, isn't it?
Well, the interesting thing is, in the past, people have been either told to go away or wear support stockings, and both have been shown to be incorrect. Support stockings don't work, they're not a cure. The problem is what's NICE. I mean, I actually applied to be on NICE and wasn't put on, and one of the troubles with NICE has been that what they show, and I think the good thing is they've shown what is correct. What they haven't done, of course, is saying how it's affordable. But what we do know is if you treat varicose veins early, the quality of life is improved dramatically. And we also know that if you look at leg ulcers, which is the other end of them getting bad, the cost of treating one leg ulcer is the same as treating the cost of curing a leg ulcer with surgery is the same as a district nurse going around and binding it for 1 year. So by in the second year, NHS, private, your own pocket, whoever pays, you're actually saving money by getting the right treatment done.
Now, I know there are going to be lots of people listening who have had varicose veins and had them treated in the old way, which is effectively, forgive my description, of yanking them out. People say it looked like yanking out sort of, skeins of navy blue wool and chucking them in the waste disposal. That's what pretty much used to happen. I know that's a very technically adept explanation, but that's the general gist of it, isn't it? That's not what you're going to be doing to Charlotte.
Absolutely not.
Please don't.
Charlotte's almost all thrown out. No, what happened in the old days, and unfortunately most people still in this country do exactly what you're saying. In fact, it's quite an apt description, but we won a research prize in 2005 and published that if you remove veins that way by what's called stripping, they just grow back again, and when they grow back, there's no valves in them, so you just grow the same vein back. What Charlotte's going to have done is what's called endovenous surgery, and what we found is if you can treat a vein from the inside either by chemicals like foam sclerotherapy or laser and leave the vein in, then it shrivels away and never comes back again, and it can be done at a local anaesthetic, which I think Charlotte's looking forward to.
Oh yes.
When you say foam sclerotherapy, that means pumping the vein full of a certain foam?
Not quite. What happens is we know that the poison that kills veins is called sclerotherapy, but if you put it into a big vein, it mixes with the blood and causes a clot. So by making it into a foam with a special gas, we don't use air, many people do, but air is dangerous to inject inside, so use a special medical gas with the carbon dioxide and oxygen, make it into a foam, and just like shaving foam, it pushes the blood out of the vein and causes a reaction with the wall that kills it. And one of the things I was talking to Charlotte about is you then have to bind the vein closed for 14 days and nights, and that's something she's not looking forward to, I don't think.
I have to wear a nice compression stocking.
I'm sure you'll look very, very beautiful, just as you do today, with or without the stocking. Listen, thank you so much for coming in. And in summation, if you have varicose veins or you see something there that you think is varicose vein, don't ignore it.
Absolutely not.
But don't let anybody just say, oh, it doesn't look like much of a big deal to me.
No. Quote NICE and make sure you get referred.
And especially people of my age, it's for the younger women who think, oh, it won't happen to me till I'm older, I exercise all the time. That's not the case, I exercise all the time. I'm very fit and healthy.
Thank you very much for alerting us to all of this. Do give us a call, 0500 288 291.